So you did. You said a mouthful. You talked about affordable health care, right? So as a state rep, what is it that you can do to bring affordable health care to your district?
Right. So, I mean, healthcare, we know healthcare is the biggest thing that's facing
It's
the
a
state
big,
outside of employment.
it's
People
huge.
don't, and the reason why that is because healthcare is tied to employment. So when people are laid off, people are fired from their jobs, they can't go back, they lose their healthcare. This is the argument for
They
why
even
we
had
should
it in the
not.
first place. If they even
Right.
had it in the first place, right? Because a
Exactly.
lot of people have jobs where they don't have it. I could think of one of the big companies that they make sure all of their employees work under 30 hours a week so they don't have to provide them with health care. The other thing they do is they contract out everything, and so they have subcontractors working in the stores so they don't have to provide health care, right? So yeah, so it's tied to employment, but there's a lot of, a lot of people have jobs and they work every day, and some of them work two different jobs, and neither one of those agencies provide health insurance for them.
Right. So it's a lot of loopholes we need to tackle, and those are some of the most important ones that I've been looking at. Is specifically with contract work, with these companies, instead of hiring employees, they're sending out the contract so they don't have to pay for health insurance. It's a sad indictment of our entire system. It's why I support healthcare for all, guaranteed to all people as a human right. Nationally through a Medicare for all system, but what I can do as a state representative is I support expanding Medicaid. This is so very important. A lot of people say the words expanding Medicaid, but they don't actually have plans on how to do it. I actually have a plan on how we're going to expand Medicaid for the people. I think we should expand it to all people. And the way we do that is we look at different models from states and countries across the world. But right here in our own country, in Massachusetts, we have what they call Mass Health. Mm-hmm. And I've been talking about, hey, how about we do this? How about we take that model and we combine our Medicaid and our children's health insurance program in Florida, the Kid Care, into one program. And then we come up with other programs with what I call a Medicare for Florida plan, where we expand this to all people. Yeah, because it's not national, we can't force it on people. So we have to give them that choice to get in, unfortunately. So we give them the choice to opt into that plan if they want, but they'll be able to get that insurance if they want. And we have it, and this is another big part to this is it should include dental, it should include vision, it should include hearing, it should include all of those things. Right now, it's so hard to go to a dentist. I've been trying to go for a while, over a year, and I still haven't had that success. I was in the waiting line and I was getting close to get to the top of the list, and then the COVID hit, and then it was like, no way.